Now, Doc, yeah.
Thank you very much. It is my pleasure, as President of the Canadian Medical Association, to install your new President in office. But first, upon the invitation of this association, and by virtue of the authority vested in me, it is my great privilege to preside at the installation of the new President. But first, Madame la Présidente, on behalf of the Canadian Medical Association, I would like to express to you and through you to the members of this association heartiest congratulations upon the achievements of the association which have been carried out under your capable direction during the past year. Please. And now, Dr. Brendan Lewis, it is my privilege to install you as President of the Newfoundland and Labrador Medical Association. During your term of office, you are charged to keep and preserve well and faithfully the statutes, customs, rights, and privileges of the association to promote its well-being and that of its members. Dr. Brendan Lewis, it is now my pleasure to declare you as truly and properly installed in the office of the President of the Newfoundland and Labrador Medical Association. It is also deemed appropriate to you as President to wear this pin that I will present you during your presidential year on those occasions that are less formal, when you may not wish to wear the official chain of office. It gives me pleasure to present to you this President's pin to be worn with pride during your presidential year and for many years to come. And also, we have a small gift from the CMA.
Thank you very much. My role next is to present to Dr. Callahan, and according to the notes I say, Dr. Elizabeth Callahan, as one of my first duties, it is my pleasure to present you with the Past President's Award, signifying great service you have rendered to this association. I've known you in the past year, and I must say that you have done an exceptionally great job representing the Newfoundland and Labrador Medical Association, and I've been very proud to know you, and I'm sure our members are very proud to have had you President. I congratulate you. Get a picture? Okay, now it's my great pleasure to share with you a few words that, about the incoming President. I'd like to thank all of the members, the CFAs, that came to Newfoundland and Labrador for our meeting. I really appreciate that. So good afternoon, ladies and gentlemen. It's a pleasure to be here today among friends and colleagues. As I look ahead to my year as President of the NLMA, I'm honored by the confidence and trust that has been placed in me. During my year as President-elect, I've been exposed to many important issues affecting physicians. I've come to realize that the medical landscape in the province has changed dramatically since we negotiated our last contract. One of the core tasks during the next round of negotiations will be reinforcing our sense of unity as an association. Our unity is the reason we were successful in past years, and we must continue to nurture that cohesiveness. And yet, while negotiations are foremost in everyone's mind today, an equally important area we need to focus on is professionalism and restoring public confidence. Medical professionalism lies at the heart of being a good doctor. It is the social and moral contract between medicine and society that recognizes our expertise, grants us the right to autonomy in practice, and extends to us the privilege of self-regulation. In exchange, physicians are committed to fulfilling the highest possible standards of medical practice. The trust that a patient places in his or her physician is an essential element of that contract, and it rests squarely on the integrity of both individual physicians and the profession as a whole. However, the relationship between doctors and society is not the same as it was a generation ago. Social and political factors, along with the advancement and promise of medical science, have altered the public's attitudes and expectations of healthcare delivery. Today, patients demand, patients deserve rapid access to high-quality medical care when they need it. But attempting to meet these expectations has sometimes proven unsuccessful in a healthcare system plagued by continual changes in organization and chronic underinvestment at all levels. This chronic underfunding has resulted in growing provider shortages, inadequate information systems, and in some cases, adverse working conditions. It has also presented challenges in program delivery, quality control, and risk management. Society's changing attitudes have been underscored by recent high-profile systemic deficiencies, which have served to undermine and erode the public's confidence in the healthcare system. There is now an increasing unease among patients in the province who feel that the system is failing them. These events have had a profound impact on the physician-patient dynamic. Patients are now beginning to question their traditional values of beliefs and are demanding greater scrutiny and oversight of health professionals vested with public trust. This trend is not simply limited to Newfoundland and Labrador. The public is demanding more transparency and accountability from all facets of the medical profession in North America. National surveys show that the respect and trust patients place in their individual physicians remains very high. However, when you look at physicians as a group, our overall reputation is slipping. If we are truly concerned about how the profession is perceived, or about preserving the confidence the public has placed in us, then we must ensure that physicians, individually and collectively, are worthy of the respect and trust we desire. The first step in restoring confidence in healthcare must, therefore, come from within the system. We must be, and we must be perceived to be, committed to transparency and accountability through self-regulation and leadership. If physicians are not proactive in supporting initiatives such as revalidation and corresponding quality assurance measures, it will be perceived as though we are resisting them. We must embody our profession's values and be prepared to be measured against them. Professionalism cannot be enforced by governments or by a regulatory body. Professionalism must emerge and be upheld unequivocally by the physicians themselves.